Hello, everybody, and welcome back. I hope you had a nice lunch, and we've got a great session lined up for you this afternoon. It is our fourth panel of the day, and it's called Reaching Net Zero Through Sustainable Procurement. Now, as we've been hearing this morning, the UK government implemented new green bidding rules for government contracts worth more than £5 million a year. All those bidding must commit to achieving net zero emissions by 2050, making the UK the first country in the world to put such a measure in place. Well, that means leaders have to embed environmental aspects of sustainability into public sector procurement policies and, of course, strategies. So, to help us navigate what those new rules mean for the sector and indeed the wider impact on sustainability goals, please welcome our panel, who are David Lawson, the Chief Procurement Officer at Guy's and St Thomas's NHS Foundation Trust. We also have David Mosey, who's PhD, Professor of the Centre of Construction Law and Dispute Resolution at King's College London. And we welcome Priya Bailey, who's Director of Procurement, Transformation and Commercial Delivery at NHS England and NHS Improvement. So welcome to you all, both David and of course, Priya. Nice to have you with us. We've said who you are and given your titles, but it would be nice, I think, for our audience if you tell us a little bit about what you do and what your job involves. Priya, let's start with you, please.
Thank you, Samina. So as you've outlined, I work at NHS England and NHS Improvement, and my role there as Director of Procurement is, one is we cover national procurements. So again, all of my team lead on over £2 billion of spend each year across the NHS, so national procurements. But I'm also responsible for the team which is leading the NHS to achieve net zero by 2045. So we thought we'd go 5 years faster than government, but would be the first health economy to declare that we will be net zero by 2045. And I also cover all procurement commercial governance across the NHS. So when you start to bring all those three together, it's really important for the agenda we're discussing today.
Yeah, and it's a big task as well, isn't it? So I wish you well with that 2045 target, and perhaps you can tell us a little bit more about how you're going to achieve that, hopefully in the next half hour or so. David Lawson, tell us a little bit about yourself.
Yep, sure. So it's great to be here. So I'm the Chief Procurement Officer for Guy's and St Thomas's Hospital, which is a large teaching hospital in South East London. And I also look after a procurement shared service, which supports another 3 hospitals in London. And I'm also the what's called the ICS, Integrated Care System, procurement lead for South East London. So I guess my job is to lead a team of about 200 people. And we cover everything from the kind of operational supply chain process into order management and kind of category management and sourcing. And we look after about 600 million of spend for the 4 hospitals that we support.
Right, so a substantial amount. Okay, thank you, David. And David Mosey, please.
Thank you.
Professor, I should say.
Thank you. I'm a professor at King's College London, so I'm a colleague of the other David by once or twice removed. We're in the same group. I am an academic specialising in improved value and reduced risk through collaborative procurement systems. I was appointed by the government to lead a review of public sector framework contracts, prioritising net zero alongside building safety and reconciling improved environmental outputs with other measures of value. That report was published as Constructing the Gold Standard in December last year, and the government accepted all of its recommendations. And I should say that NHS framework providers were 2 of the major client contributors to the consultation that led to that report.
Great. Okay, so hopefully we'll hear a little bit more about that as well during the next half hour or so. But let's start with the basics, really. And David Lawson, if we could go to you first, David, can you tell us a little bit about what you're doing towards achieving net zero in terms of direct and indirect emissions?
Sure. I guess the context also, if you look at healthcare, if healthcare was a country, I think it would be the 5th largest emitter of greenhouse gases if it's a country. So healthcare has got a major is kind of major contributor. I guess in terms of direct emissions, one of the key areas that we're targeting is anesthetic gases. So in our kind of main theatres, anesthetic gases kind of just normally vent out into the atmosphere. And I think across the NHS, anesthetic gases account for about 4 or 5% of the total kind of footprint. So we've changed our protocols. So we've designed out the use of what's called desulfurane. And now the next stage is to pilot the use of gas capture technology on all the anesthetic machines across our theatres to further kind of address that kind of direct emission. I guess in terms of indirect initiatives, a key area is working with medical device companies. And one of the areas is particularly looking at recycling devices. So we're doing a program in our electrophysiology theatres to recycle EP catheters, but also we're looking at practice as well. So trying to move away from single-use consumables and to move back to reusable consumables, and that's a kind of major area of focus. And I guess we're doing lots of things, but I guess for time, I guess the other thing is around transport. So hospitals consume huge amounts of materials and products on a daily basis. So one of the things that we've done at our local hospital is also to consolidate our deliveries through an urban consolidation centre. We used to have about 40,000 truck deliveries per year arriving into the hospital into central London. So we now have consolidated those off-site and have electric vehicles delivering direct to site. So something around air quality as well. So lots, quite an array of initiatives, but I guess the key ones around anesthetic gases and then looking at medical devices in terms of current initiatives.
Yeah, and it's fascinating to hear about that, because I guess to most people, you know, these are the things that are happening behind the scenes that perhaps we as the public don't necessarily consider. So it's great to see the range of changes and certainly work that's being done. Priya, you know, I know David has talked about a whole range, as I said, but that drives innovation, doesn't it, in the supply chain? And that's what we need at this stage.
Absolutely. I think the opportunity around net zero and is really around innovation. When we think across the NHS, we have over 500,000 products that we use working with our 80,000 suppliers. In order to achieve net zero by 2045, we will need changes across every single one of those products and those supply chains. I mean, to do and support that is, I mean, from the 1st of April, what we've introduced across all of the NHS is a minimum of 10% weighting into all of our procurements. So again, is how do we start to really encourage that piece? I think some of the examples that David, when David was talking, I started thinking about when you start to look at electric net zero ambulances. You know, again, energy is transport is a key element of the NHS. Across the NHS, we have over 6 billion miles a year across the NHS. So looking not just around our ambulances, but our staff, but also our patients and our supply chain. These are significant areas where we need to start to use digital to start to reduce the amount of transport on the road. So how do we support digital around our innovation, around our patients' procedures, but lots of different elements that we start to really drive this going forward. And I think the recognition around innovation is how do we work with especially some of our small businesses, because it's often those small SMEs where we're starting to really see that innovation, and they need to know and have sufficient backing from the change in demand of the NHS for some of those products. And so more and more work we're starting to do with SBRI around funding being made available for some of these smaller SMEs to help to really stimulate that innovation to become available for the NHS going forward. But absolutely, it's a key area to drive forward for net zero.
You were talking about the SMEs. Does it make it harder for them achieving net zero ambitions?
I mean, part of what we've built in, so we have a supply chain roadmap, which essentially is a number of steps of how we're going to get to net zero. Part of the roadmap is a recognition for, yes, it is going to be more challenging for some of the SMEs. So some of those targets have got a 2-year grace period in, specifically for SMEs. Also dealing with a number of trade associations and specifically associations which are dealing with SMEs, to to understand some of the challenges that they would have around achieving some of these targets. So it's looking and understanding those pressures, and then looking at what policies and support we can provide for some of those SMEs to really drive them and help them to achieve these targets going forward.
Okay, Professor Mosey, I just wondered if you could come in at this point, because I wondered if you could answer how a client would build in net zero carbon into their strategy, into their team selection, contracting, and indeed project management. How do they achieve that?
Right, well, let's start. I'm going to focus on construction, because construction is estimated by the World Green Building Council to be 39% of our emissions. So we'll look at construction and building operation. Priya has talked about innovation there, and a lot of construction innovation comes from tier 2, tier 3 SMEs who are left out late in the procurement process by architects and engineers, are left out of the procurement process by main contractors bidding on lowest price. And as a result, those innovations, if they ever emerge, are discounted. So saying as a client, I want net zero carbon, if you don't mind, is really insufficient. We need to look at the machinery of delivering it. And the way to do that, I would suggest, because we do have worries about intellectual property, we have a defensive environment in construction where people keep their knowledge close to their chest. The way to do that is to create strategic workflow for all levels of the supply chain, such that they see a commercial reason to share their good ideas and allow those ideas to be used incrementally. Because at the moment, we're in a Groundhog Day. We have innovation, we have commitment, we have expertise. It gets used on one project and then it's hidden away in the safe until you bid for the next project. That is not going to get us to net zero by 2050. Okay,
so it's dangling a carrot as well to a certain degree, isn't it?
It is, but it is the machinery for that. And I think this is the point, the idea of incentivizing, not by throwing additional money, but certainly by offering additional work, but then re-engineering relationships. We can't create all these ideas in a bid process. In a bid process, people haven't even got any work to justify their investment in net zero ideas. Once they're appointed, particularly to a framework of multiple projects, then separate from the award of the contracts, sort of sitting in a taxi rank waiting for the award, you can say, right, you're in this group now, we will work jointly to pursue net zero, and we will work with SMEs locally, we'll work with manufacturers of off-site solutions, because you will then help us to rationalize the delivery of our targets and, of course, to earn the award of additional work. So that machinery is a lot more than the typical sequential award of projects. It is actually going into a collective contractual commitment as to how we're going to deliver net zero.
Okay. David, have you put any of the machinery that we've just heard about from Professor Mosey into practice, and has it worked?
I guess, yeah, I mean, I think it's an interesting point about SMEs, and in a way, the way I see it is, it's both for SMEs, this agenda is both an opportunity and a threat, and it depends on how we as from a procurement profession kind of approach it. So it's an opportunity if we're open and encourage innovation, and it gives SMEs the opportunity where maybe previously they didn't have the opportunity. But equally, it can be a threat because it can be a barrier, because we can create a whole additional layer of requirements, which it makes it hard for SMEs without maybe the same level of resources to then kind of be involved in kind of bidding processes. So I guess what we've been trying to do is kind of adapt our own practices so that we don't make this agenda a kind of a disincentive for innovation. I guess, but the other aspect I wanted to kind of, or point I wanted to make is that the other aspect around innovation is also how do you scale up innovation. So the NHS is famous for having these islands of excellence and failing to scale up and diffuse good practice. And in a way, that's, again, it puts the onus on us in terms of, from a procurement perspective, to collaborate among our peers as well. So not just with industry, and also with ourselves, with other hospitals, with other sectors. So there's something around innovation, which is about how do we kind of address that challenge of moving away from islands of excellence to kind of diffusing good practice. But I guess to answer the question, I think a lot of it, how do we put it into practice? I think it's about thinking carefully before we launch into kind of procurements, to kind of understand where the kind of barriers could be, and trying to make structured processes to, whether it's directly with SMEs, or as David's kind of pointed out, actually some of these opportunities are further down the supply chain, down the tiers. So therefore it's how do we influence our tier one suppliers to engage with their supply chain in a more kind of proactive way to meet this agenda.
Okay.
Desperate to jump in, if that was allowed, Samina.
Please do.
Merely to say that Procure 23, which is a major NHS procurement initiative by NHSEI, and also NHS Shared Business Services, are contracting through what happens to be a King's College research product, the FAC1 Framework Alliance contract, which I might as well jump straight to the point, because the NHS is doing this, which creates this medium for shared ideas, and which embodies this machinery for the tier one providers to be led by clients or groups of clients into a new form of engagement with their supply chain. You know, I mean, David and Priya and I can talk about that after today, because these are new developments. But I think that at a sort of macro level, that machinery is really helpful, even though, you know, individual NHS trusts have frontline delivery issues, you know, bombarding them every day of the week. Yeah, to see that is very encouraging, and there is a welcoming of that approach, because it does, that contract defines improved sustainability as including reduction in carbon emissions, and describes what are called action plans with timetables. So again, the contract isn't a frozen arrangement. It opens the door to step-by-step incremental improvement.
Okay, you said that was a new development. Forgive my ignorance. How new is that? And is that the reason it's not necessarily been rolled out?
Well, it's a good question. It's been adopted on the face of it on £90 billion worth of procurements, but it has only existed since July 2016. So Crown Commercial Service, who are working on Procure 23 now, adopted it pretty early in the piece. NHS Shared Business Services procured using it only last year. And I know all of that because, as I say, that report, Constructing the Gold Standard, led to everybody very kindly sharing everything that they're doing. So incrementally, it's moving quite swiftly, but early results, as you would expect from a university, have been scrutinized and turned into impact case studies. So we've got a good evidence base for what people are able to do.
Okay, that's good to know. Thank you. Priya, are there any particular sectors that you're focusing on that require a tailored approach, much more specific?
So I was going to come in just a little bit off the theme that David was talking about, construction. And I think, I mean, what we're starting to see a lot more now, and my team around sustainability is working with a number of trusts and local authorities as well, around looking at new innovative ways around procurement. So David was mentioning sort of architects and how they're sort of forgotten as part of this construction. I mean, it brought to mind an example of the Southwark Council has done a really good DPS framework. So, you know, very close to David and both Davids. And actually what was really great around that particular DPS was how they reviewed the requirements around procurement to really recognize SMEs. And so instead of asking for significant turnovers for some of these suppliers, what they started to is really reduce the requirements, but still be proportionate. So still, and still look at getting the references, understanding and getting still a level of compliance, but it completely opened up the market and has really created a vibrant market around architects and people to support construction. And it's the sort of procurements and examples that we're looking at, because one, it supports local, it supports the community. So again, around social value and how they've implemented social value into, but also around sustainability. So how we start to really break down around those local communities and supporting SMEs as well, and creating new markets.
I'm going to come in one more time, Samina. I've got to do this. This is amazing, because that Southwark example uses the FAC form in a totally different way, exactly as Priya described, to create, and this is a really good takeaway, a community of SMEs, individually, and micro SMEs. They're too small on their own. As a community, linked through this multi-party arrangement, suddenly they have purchasing power, they have the ability to share ideas, they become very influential. So I was just so delighted, Priya, that you came up with that case study.
Well, I was wondering, I was just wondering, what was it specifically that allowed that to happen? I know you mentioned about the way they use that form, but certainly the way it was put to them. What was taken away that was there previously, perhaps, that didn't allow them to do that?
What was used was leadership. It's in the hands of leaders.
I was exactly the same.
An amazing woman called Shona Snow, who's ex-Southwark, now LHC, led this procurement and worked so carefully on the strengths of the SMEs. So it's not a sort of positive discrimination thing. It is, right, what are your community strengths? What do you offer? And how will you then buy into this joint machinery? So leadership is the key to me.
Okay. I know you're all nodding. Yeah. Do you want to add anything to that, Priya? Because that was the example you brought up. I know you was just.
But I think what was really helpful for me around that example was, I mean, David's point around the leadership was, for some of these procurements, it is about where people are risk averse. It is about saying, actually, well, we put all these different layers into our procurements because we're trying to cover every single element of risk. But actually, when you start to look at what's really proportionate and relevant, this is where it starts to bring out the innovation, where it starts to create markets and also makes it achievable for SMEs. And I think if you take all of those different principles and start to look at innovation across all the areas around net zero where we need it, it's those sort of examples that will help us to create and look at some of the different areas. I think with the formation of integrated care systems, David also mentioned he's the one for his region. This is the opportunity as well of how local authorities and health start to come together. I mean, one of the areas we've been looking at is walking aids and reuse. So again, how do we start to look at, and these are areas not only do the local authorities use, but also the NHS uses, and the opportunity about bringing some of those contracts together in order for them to make them more financially viable is a real opportunity. But it also supports local businesses. It's how we start to work with some of our local suppliers, so local charities as well, for more sustainable outcomes going forward. So big drive and big push in some of these areas. And of course, this week is National Stationery Week.
It is.
And so again, where some of the announcements I saw guys in St Thomas announced they moved to paper cups. And so again, there's all of these really great initiatives across the NHS. NHS England will be making some announcements this week as well, so look out for those. And again, of how we start to move to more reusable and also more environmentally friendly products, but also how we start to work with all of the NHS to do the same to drive it forward.
It's great, isn't it, that we have a week for everything now, but it does help with the awareness raising, doesn't it? And it works. David Lawson, I just wonder where you see the opportunities for greater collaboration with suppliers, with customers, and indeed employees.
I mean, the great thing I guess we've observed post-COVID is that there's almost a huge kind of bottom-up desire particularly from clinical teams to do more and be really proactive, and for clinical kind of leads to lead in this area. So we've got a great set of consultants within the organization who are actively trying to push different initiatives. So in many ways, that makes collaboration a lot easier when you've got a body of people wanting to do stuff. So the door's very much open. So huge opportunity, I think, right now in healthcare. Huge opportunity for SMEs as well to kind of break kind of status quo, because there's a greater willingness, particularly from clinical teams, to try different things and take a measured risk. So great opportunity for collaboration. But I guess to my earlier point, it's also important for hospitals to collaborate with each other as well. And also, within healthcare, we have these kind of integrated care systems, which is also about collaborating with other public sector organisations within our local community. So, for Guys and Tommies, that is with Southwark Council, it's with Lambeth Council, it's with King's College London as well, who've got quite a strong kind of civic programme. So, and huge. So, I think there's a lot of potential right now, particularly post-COVID, where you've got our kind of workforce who want to do stuff and are almost kind of demanding change. And I guess the opportunity for suppliers, big and small, is to kind of work with hospitals and other public sector organisations to take things forward.
Okay. Professor Mosey, I just wondered if there was a specific type of contract that you felt delivered improved sustainability.
Well, we've discussed that in some way. I think
detail,
insofar as there's a published form, it is a contract as an integrator. The problem with construction is that it is used to what Dame Judith Hackett in another context called the race to the bottom. Procurement is about lowest price, and contracts are about freezing that lowest price and dumping as much risk as possible on the contractor, which then gets dumped on the suppliers. And we know, to our terrible cost, the consequences of that in construction and housing terms. Well, extrapolating that out, we can't go on. People's comfort zone of, if I procure lowest price, I'm not doing the wrong thing. If I stitch people up in an adversarial contract, I'm not doing the wrong thing. These are the wrong thing. They're demonstrably the wrong thing, but they're deeply embedded in the DNA of every construction lawyer, procurement officer, architect and engineer, and every contractor is prepared to game the system. It's an ugly sport if you look at it closely. So there are contracts, if they're integrated with the other stages. Now, I'm not, as a lawyer, I'm more interested in contracts than most people, but I have to say this, we should be looking at strategy, which we've talked about today. How do you articulate the strategy in a contract? We should be looking at innovative proposals from each level of the supply chain. How do you integrate those in the contract? And we should be looking at management systems, because managing construction is a high-risk business. How do you incentivize managers to support teams rather than issue orders? And if we can tie those together, then contracts have a new role.
Okay. You mentioned there about incentivizing managers. What's your take on that? What is the way to do that? Because that's changed as well, hasn't it?
Well, I think strategic managers need more respect. I think managers can be confused with administrators, and not decrying administrators, but there are skills. I think I look to people like SIPS and the RICS in construction to empower a new approach to management. We're not short of good people, but they're taught a very binary approach to management, which is so risk averse that they hesitate to do new things. So I've seen that it's always on the next project, when there's more time, that we'll do something new. However much we prove that you save time through these systems, there's always some time-related excuse. So to me, the skills are there. The professional bodies and the educational institutions need to see this approach as an imperative rather than a sort of nice to have. But when I say leadership, the Southwark example, that is someone who has, from a relatively junior position, assumed a position of leadership because she could see how that would make a change. And so it's, I guess, incrementally looking for more examples of inspiring managers and giving them the tools to work with.
Okay, thank you for that. I know we've not got very long to go, so just a quick question to all of you, really. David Lawson, what can we learn from other sectors, and you know, how do we implement that to make it work for ours?
Well, I guess one of the challenges that we have is around measuring our carbon footprint and using that data to then prioritize. So I think what we're finding is that other sectors have kind of gone through that challenge already. So for me, there's an opportunity for healthcare to learn from other sectors about how you measure and then how you prioritize to make sure that your efforts kind of are focused on those activities that give most return.
Okay, thank you. Priya, what are your thoughts on that, about learning from other sectors?
I mean, I agree. And I think the example that I gave of looking at Southwark as a local authority is really understanding what innovation and what best practices is happening out, and how people are being brave, especially around how we use procurement regulation to support sustainability. So what we're trying to do is really look at all of that best practice and bring that into the NHS to help the NHS not start from scratch, but help the NHS along this journey. So yes, welcoming all new innovation and ideas to bring to the NHS.
Yeah, and long may they continue. Professor Mosey, we'll leave the last word to you. Success, I suppose, in looking down the line, couple of years, even the 6 months target that we've been given already, you know, what does it look like to you?
It looks like the question you last asked, which is, you know, other sectors. The motor industry has learned a long time ago that you don't need to reinvent the wheel. The construction industry keeps reinventing it. If we're going to meet our targets, we have to work with the wheels we've got and get people to use the same wheels. Don't want to exhaust that metaphor, but the expertise is there, the individual commitment is there, the innovations are there. We need to join them up, and then I think the future for that 39% of our emissions could look an awful lot healthier.
Great. Well, on that optimistic note, we will leave it there. I'd like to thank you all for joining me. It's been fascinating talking to you and really, really helpful. So Professor Mosey, David Lawson, and also Priya Bailey, thank you very much for joining us this afternoon. Thank you.
Thank you so much, Samina. Thank you.
Thank you.
Pleasure. Thank you.
Bye-bye.
So a huge thank you to our panel and indeed to everyone who has taken part today. We've covered a whole range of challenges, opportunities and solutions as we discussed the topic of public sector procurement. And whether you're one of the many excellent panelists that we heard from today, or you've been part of our audience who's been sending in questions, a huge thank you from all the team here at PSE365. Thank you also to our fantastic partners, without which events like this wouldn't be able to take place. And it's a shame, really, but it is the end for today. However, I look forward to seeing you back again for our event on cybersecurity. That's happening on July the 14th. Please do let your colleagues know, and we'd love to welcome new faces to the platform as ever. If you're a winner in our gamification challenge, the PSC team will be in touch to discuss your prize. In addition to that, today's event was CPD certified, as we said at the beginning, 1 CPD point earned for every hour of live content watched. So if you'd like your certificate, once again, please email marketing@cognitivepublishing.com. From me and from everybody at PSE365, I want to say a huge thank you to all of you. I hope you enjoyed the conversations. I look forward to us having many, many more, and hopefully we'll see you again at the next event. For now, though, from all the team here, enjoy the rest of your afternoon, and bye-bye.